So big question is really who should freeze their eggs and why? So the beginning of egg freezing was really medical reasons for freezing eggs. Mostly it started off with cancer patients. So there were young women, sometimes even teenage girls, who were then needing to have chemotherapy, radiotherapy to treat their cancer. And of course, these treatments are very harmful to the ovaries, to the eggs, and then could affect this woman's fertility who's still not had children. So the idea was that the eggs should be extracted prior to the chemotherapy or radiotherapy so that these eggs can be preserved for the future. Or the other thing that they tried was taking a wedge out of the ovary, extracting a whole segment of ovarian tissue to freeze and keep for the future when this woman may want to try and have a baby. So it all started off really for medical reasons. Mostly it started off with cancer. Sometimes there are women who needed to have their ovaries removed for medical reasons or for cancer prevention when they have genes which could then lead to them having ovarian cancer, and some other health issues that would mean that the woman wouldn't be able to get pregnant or may have difficulty getting pregnant in the future. So it started off with medical reasons. Of course, with time, this evolved to then women who froze without medical reason, just for their personal choice. And the big change really came about 10 years ago when the ASRM in America, they kind of removed the experimental label from egg freezing, which used to be considered as an experimental treatment. They removed that label about 10 years ago, and then it kind of opened the door for more women to be starting to do this process. And for personal choice, women would do it. They would choose to delay becoming a parent. It could be maybe because of their career. This is a very common one nowadays. 2 or 3 generations ago, women were mostly having their firstborn child in their late teens or early 20s. But now, of course, this isn't a commonplace, and women are delaying having babies due to career, due to maybe not having a partner, or other reasons which are to do with modern lifestyles. And yes, it's great that women now can have that choice to have a career and fulfill other things, but it kind of took away a little bit the choice of then maybe having a baby if they became too old or they didn't have enough eggs later on. So therefore, freezing the eggs is a form of family planning. I mean, normally when we say family planning, people think about contraception, and yes, that is one form of family planning, but this is a new form now where you can kind of plan your family for the future, and actually, family planning in terms of having a baby, not trying to stop yourself having a baby, which was the traditional feeling for family planning. Some women do it because maybe they have a family history of early menopause, so maybe their mother or their elder sisters have been having menopause at an early age, under the age of 45 or sometimes even 40. And they're scared that maybe if they wait until they are in their 30s that they won't have enough eggs, or they may have also very early menopause. And some women just do it for peace of mind. They just want to have some eggs frozen when they're younger, because then if they do get older and then they have any troubles, these eggs will be there for them to use as a backup. Now, the biggest factor to do with egg freezing is really the age of freezing the eggs, because women are born with eggs. It's not like sperm, which is constantly being produced and made. You are born with your eggs and you just lose them with time. You lose them even before you're born, and even before you go through puberty, you would lose your eggs. And even if you take the contraceptive pill and say, I'm fine, I've not been ovulating for the last 20 years because I've been on the contraceptive pill, unfortunately, you still use your eggs. Now, not only is the number of eggs being reduced, but actually the bigger factor by far is the quality of the eggs is reduced as well as you get older. So especially as a woman approaches 35 and beyond, each year, the quality of eggs does reduce quite a significant amount. And when we talk about quality of eggs, it is the chromosomes, the genetic makeup of the egg, which will then reflect the genetic makeup of the embryo and lead to what we call aneuploidy, which is the incorrect number of chromosomes in that embryo, which then most likely doesn't lead to pregnancy or leads to high risk of miscarriage or abnormality in the baby. So when you freeze an eggs at a younger age, there's more chance that these eggs will be better quality and therefore better chance of having a baby with these eggs. If you freeze your eggs, for example, when you're 30, and then you come when you're 44 to use these eggs, then definitely these eggs will be much better quality than any eggs you produce at that age.